Hey, everybody. Can everybody online here, you can just give us a thumbs up? All right, great. Well, we'll go ahead and get started today. I'm Krishnaswami. I'm the current president of the AAGS. So welcome and thanks for joining us today. I know we have a lot more people online from a bunch of different countries all around the world. And hopefully we'll have an interactive and informational meeting of the organization. And we want to thank Operation ACS Hope for supporting the AAGS with technical help and this meeting space for us today. We plan this to be an interactive session today. There'll be opportunities, there'll be a lot of QR codes. Please scan those QR codes into different windows in your phone or computer, and then you can go back and refer to them later on as we go. There'll also be some opportunities for questions to be answered as we go forward as well. And then stop sharing for that.
Yeah. You're not
You need to try to link in the chat. Yeah. Sure. Great. What if people in the room aren't seeing it, people online aren't? Yeah.
See if I can have it.
All right. So we asked first question is where are you joining us from today? We can see that there's people from kind of all over the world. We're very excited for you to join us today. And hopefully as the session goes on, we'll have more and more people joining from all over the world. All right. So today, we're going to start off talking a bit about the AAGS as far as purpose, values, framework, demographics, and some recent initiatives of the organization. Like I said, we're gonna talk about purpose, values, framework, demographics, and some recent initiatives of the organization. And from there, we're excited to present the progress of our accreditation committee in creating criteria for common standards in academic global surgery. As part of that, we'll do some breakout sessions to discuss critical concepts towards accreditation in smaller groups. And then we'll round out with a report by our membership committee on the rationale for membership in the organization, as well as a ode to a new packet that we'll have for membership that's going to anchor our upcoming membership drive. And finally, we'll close with some important information on upcoming organizational events here at the ACS and beyond. So I'll first start off by defining what's academic global surgery. Our organization defines it as the application of research, education, and evidence-based advocacy towards clinical surgical care in the regions of health and equity. And that's wherever that may be, HIC, LMIC. The primary goal of the field is, as listed there, is infrastructure development with delivery of high quality surgical care across geographic or economic boundaries. Therein, the purpose of the Association of Academic Global Surgery is to serve as an umbrella for that field, promoting academic principles within global surgery, organizing and cultivating academic global surgery programs from both sides, fostering equitable bidirectional partnerships, and advancing the importance and visibility of the field, and developing the next generation of global surgery leaders. We currently have 5 membership categories, and that's intended to span the range of involvement in academic global surgery. Again, all these QR codes that you'll see along the way today, feel free to scan them and keep a window open so you can refer to them later. So we have almost 500 members that hail from 45 different countries, 28 of which are LIC or LMIC, and 17 of which are HIC or upper middle income countries. So while we're very diverse geographically, as well as by gender and some other metrics, we continue to seek out passionate colleagues from LMICs to join committees, and more importantly, organizational leadership. While our first members and their programs were really here in North America, the aim from the beginning has been to make this a global organization. So those of you who are listening from around the world, please join. These are the committees that do the work of the organization. We'll hear from a couple of these committees today, but you can learn more about the work and committee goals on our website. In addition to the QR code, here it links to a form for self-nomination for these committees. Of our members, about 150 are involved within the committees. These flags represent the 27 countries of our committee members, hailing from all the WHO regions, each bringing invaluable experience and insights to the AAGS. It's an exciting time as our committee self-nominations are open, as I mentioned, and you can apply to join these committees. Once you're in a committee, you not only have the opportunity to contribute to the work of that committee, but you also have the opportunity to lead, because each year committee members select their leadership, and importantly, we've made a commitment that by the end of the next year, 50% of our committee leadership will be LMIC oriented. So we invite you across the world and here in the room to join us in ensuring the ownership of AAGS by everyone across the entire community of academic global surgery. In this vein, our executive committee went through some revamping to match the needs of our kind of fast-growing organization, with Professor Emmanuel Ame joining us earlier this year as the very first Vice President for External Affairs. In that role, he develops and manages our external events and organizational collaborations and creates guidelines for joint deliverables, amongst other duties. Dr. Ame is obviously a well-known figure in global surgery who's previously held pivotal roles in many aspects of our field, and we are thrilled that he has joined the team. So now turning our attention to our organizational events this last year, I'll start with 1 year ago here at the American College of Surgeons in October of 2023, where we held an overview of our committee's work, highlighting our various committees' work, highlighting the work of the research, advocacy, and ethics committees, amongst others. And we learned of their publications, their interactive forums, and their guidelines. 150 registrants from 39 countries, and many dozen more joined in person to hear about the impactful work and discuss ideas, obstacles, and opportunities in academic global surgery. There, we had a really enthusiastic and spirited discussion both in person and online. In December of last year, we held our annual assembly virtually, featuring the second session of our academic global surgery seminar series focusing on innovation. These AGS seminars are meant to facilitate organizations, institutions, and programs across the globe to work together, developing and presenting joint material on a regular basis that's of utility to all of us in global surgery. And they're in breaking down physical and intellectual silos. As a second part of that assembly last December, we held our second ever scientific program with abstracts from 8 countries representing all the WHO regions. The program then concluded with our first general membership meeting since the formation of our executive committee. This past March, we held our first event outside the US at the West African College of Surgeons in Sierra Leone through an exciting and engaging session specifically about initiating, developing, and maintaining equitable bi-directional collaborations. We had a distinguished panel, mostly of regional experts and a couple of people from higher income countries as well. We had almost 100 persons joining us 100 participants in person and online from 27 different countries. As a truly hybrid event, it was a major proof of concept for our organization that with minimal technical adjuncts, we can hold a hybrid session anywhere around the world and provide a way for us to meet our colleagues in all of their own regions. Overall, the feedback from the session was overwhelmingly positive. So as you're listening to this, please let us know if you are going to international meetings and foresee any opportunities for the AAGS to host or co-host sessions with partner organizations around the world. Equally notable, with the sponsorship of our Operation Small Partners, we presented our first AAGS Travel Scholarship Award. Dr. Sanjay from India, who presented the winning abstract at last fall's virtual assembly, had his conference registration and travel to the AAGS hybrid event at WACS, the West African College, sponsored through this award. This is going to be an annual scholarship, rotating amongst organizations where we hold annual sessions and will allow the AAGS to promote this united community in academic global surgery. In April of this year, AAGS had a significant presence at the Consortium of Universities for Global Health meeting, where associate member of the advocacy committee, Dr. Krishnaswami, presented the committee's work on overcoming structural barriers to equitable global health clinical education exchanges at a CUGH site event. The registration for CUGH for Dr. Sani was supported by a new AAGS initiative, which is deemed the Future Leader Scholarship. That's designed to support training to attend and present their work of the AAGS within organizations at their international meeting. And to support such scholarships, initiatives and opportunities, looking forward, that we're trying to build for trainees both at LMIC and around the globe, we need help. You all can donate to these efforts by scanning that QR code, which will also be presented later on in the presentation today. In completing out a busy first half of the year, in May, our Vice President of Finance and Vice President of Internal Affairs attended the World Health Assembly and side events. As part of those events, they joined and represented the AAGS at the 2-day G4 Alliance Permanent Council meeting. The AAGS was also a co-sponsor at a WHO side event that had launched the WHO G4 Alliance Operative Encounter Registry. That's a WHO hosted registry that's designed to electronically collect periodic data in an effort to record and improve surgical outcomes around the world. Formal piloting of that registry is going to begin later this year. From a scholarly standpoint, AAGS has been equally busy publishing partnership guidelines in concert with prominent certified organizations and creating important guidelines for our field, including this most recent one pictured here. As you're aware, scientific conferences are a key medium of our academic exchange. Equitable access to conferences is required for building and improving surgical healthcare worldwide so we can all learn together. Last week, the outcome of a two-year effort by the AAGS Advocacy Committee on developing a consensus statement on conference equity was published. The article was published in the Journal of Global Surgery, and in a record 30 minutes was crowdfunded and made open access. In just the 1 week since its publication, it's already garnered more than 400 article views. And we really aim to implement this work that is in this publication by partnering with organizations internationally who could adopt these for their own conferences. So speaking of the Journal of Global Surgery, we are particularly excited about this latest in a line of important partnerships that we formed with groups including Incision, which has led to collaborations with trainees around the world on many events, the G4 Alliance, as I said, Smile, and many others. The Journal of Global Surgery is really a groundbreaking peer-reviewed journal that's dedicated only to global surgery and is powered by Bitcoin Cash. Their business model produces a low-cost, community-funded, high-quality, open-access journal that's sustainable, affordable, accessible, and meets the needs of the entire global surgery community. We're really thrilled that as of 2024, JOGS is the official journal of the AAGS. As a new entity, after 2 years of regular publishing, articles from the journal will become PubMed indexed, and all articles leading up to that time will be retroactively indexed. The journal currently has an open call for papers for their upcoming issue. So please consider submitting your work to this emerging entity. And we really hope that this effort is going to really leapfrog existing barriers to equitable dissemination of global surgery research. So that's a quick whirlwind overview of the current work of the organization. Now we're going to move to our accreditation committee work on developing common standards for global surgery programs. To that end, I want to introduce Riddle, who's our chair of the accreditation committee, who's going to be joining us online, who's going to be overviewing this topic.
Thank you. Can everyone hear me there?
Yes.
Great. Thank you for the introduction, and thank you to Dr. Krishnaswami and the executive committee for the opportunity to present the work of the accreditation committee today. My name's Eli Riddle. I've been the chair of the committee. I'm joining today from New Jersey, USA. I work as a general surgeon at Rutgers, New Jersey Medical School. Next slide, please. And while I have the privilege of presenting our committee's work today, I want to be very clear that this has really been a group effort from a wonderful group of engaged clinicians and program administrators, trainees in the current year among our current membership, and also in past years where our previous committee members had a lot of the discussions that I'm going to describe today and started building the work that we're presenting now. Here you can see the names of our members and also the location of their primary work. We still are more than 50% US based, but we're making an active effort to expand our membership. We're very happy and have been fortunate to have the perspectives of engaged members from multiple WHO regions. And we're actively trying to expand because we know that if we're going to develop an accreditation process that's truly equitable and impactful within the field of global surgery, we need as many diverse perspectives as we can find from those across different levels of training, from different geographic regions, from different types of programs. And so, as was mentioned, the committee nomination process is open, and we hope that some of you who are watching today or your colleagues will join us to continue this work as we move forward. Next slide, please. So I personally found out about AAGS and became involved in the committee in San Francisco in 2019 when I attended a meeting there. But in talking with others who helped to found the organization, it was my understanding that looking ahead to accreditation and developing standards and guidelines was a key impetus in founding the organization. And the Accreditation Committee has been tasked with developing these guidelines and criteria and an accreditation process. Our committee started meeting in the fall of 2020. Of course, at that time, everything was virtual. And at that time, all of our committee members were primarily based in the US. And over time, the committee has evolved and our work has evolved and grown. Along with all of the other committees of AAGS, we engaged in a strategic planning process primarily in 2022. As part of that process, we were asked to examine the gaps that might exist both externally within the field of global surgery or with programs that our committee might be able to address with our work. I also think about internal gaps within our committee that we could address to make our work more impactful. So in terms of external gaps, our two primary gaps that we identified were a lack of standardization and guidelines and what constitute a global surgery, academic global surgery, and best practices. And also a lack of recognition of many of the efforts that our committee members and those outside of our committee were contributing in their global surgery work. And then within our committee, we recognized that we needed to increase the diversity of perspectives inside our committee, and that was a primary gap that we sought to address internally. Out of that process, we developed a series of goals, and the primary goals we've been working actively since that time to address are listed here. We aim to establish guidelines or criteria for program accreditation in academic global surgery. We want to attain not just a diversity of perspectives, but we hope to achieve a consensus within our committee and then within AAGS as a larger organization. And to that end, we hope to leverage the partnerships with the other committees within AAGS who are focused on different areas and thinking about what guidelines and standards might be within those areas. So we expect in the future to be reaching out to our different committees, education, research, ethics, among others, for review and feedback of our criteria. We also are appreciative of and seeking the guidance and review of the executive committee, the leadership council, potentially the institutional committee in the future, and any members who are actively interested. And then internally, as I mentioned, we identified a gap. And so we've been actively working to expand the diversity of our committee membership. And really, I'm very grateful to have a number of very active and engaged members from outside of the United States and who are trainees that are helping us to think about different perspectives. As we identified these goals, we started to review different resources that were available, publications where people had suggested guidelines and best practices. We looked at different accreditation systems to see what we might mirror ourselves after or what these processes looked like. And this really led us down a very deliberative and iterative process of trying to ask questions of of ourselves as a committee to make sure that we made this an equitable process and something that would truly be impactful. And so I wanted to share with you some of those questions that we've been asking within our committee. And there'll be a chance later in the breakout sessions for everyone to, again, share with us your feedback and your perspectives on these. So the first question we asked was why? Why does the AAGS want to promote accreditation? And why would a academic global surgery program want to be accredited by AAGS? Some of the answers that we came up with as a committee is we want to promote accreditation so that we can help to establish, maintain, and promote best practices within academic global surgery. This is a way to potentially protect vulnerable parties in global surgery. We want to be mindful of that. And this could be a benefit that AAGS could provide for global surgery programs. From a program standpoint, accreditation may be a way to increase legitimacy in the eyes of other organizations, their sponsoring institutions, funding sources, ministries of health, et cetera. A set of accreditation criteria or guidelines could be helpful as a roadmap for program development and quality improvement for programs who are just starting or those who are attempting to expand their work. And this could be a way for programs to identify reliable collaborators or trainees to seek out programs where they might have opportunities to do training or to engage in research or other activities. Next slide. We also have asked the question of who is this for, and which programs would be seeking accreditation. We spent a lot of time within our committee discussing the definition of academic global surgery program. And you saw the definition that Dr. Krishnaswami presented earlier, and we've adopted that as our definition that's guiding our efforts now. We also recognize there's a lot of diversity within that definition in activities and structure, in locations, and we want to be cognizant of that and thoughtful of that as we go about our work to try to make sure that our accreditation process is inclusive and as equitable as possible. Next slide, please. So a lot of our work this year in particular and our current activity is focused around this idea of what. What are the actual criteria going to be for accreditation in academic global surgery? And this is where we really are going to be seeking consensus from the entire organization and trying different ways to reach out to people and get their input. Some of the questions we've asked ourselves when thinking about criteria is should we try to keep them very broad so that we're maximally inclusive of programs that we're considering? On the other end, should we try to make them very specific to facilitate the process? It's much easier to check something off if it's very detailed and specific. We've asked if there should just be one set of criteria for everyone, or potentially tiers of criteria, recognizing that there's a wide range of program organizations and resources, and that not everyone may be doing the same things or at the same level of development in their program. We've asked if criteria should be universally applied to all programs, or if there may be different criteria for different programs. And that could be based on a number of different factors. Some programs have different focus areas. They may be more focused on training or research or clinical care. Other programs may be engaged in efforts in all of those areas. And we need to figure out how we consider that in a process. It may also be based on location or resources in terms of what people are doing and how they need to represent that they're following best practices and guidelines. We want our criteria to be fair and able to be applied equitably across a wide range of programs. But we also want the criteria to be rigorous enough that this is truly an impactful process at the end of the day. Next slide. Ultimately, as we answer some of these other questions of who this applies to and what the criteria are, we have to answer the question at some point of how. How would AAGS grant accreditation? What is the process? There has to be some type of application, a committee, what's included in this. There are application materials to submit. Would there be a site visit? Would there be continued data submission that's under consideration? Depending on who is engaged and what is involved, we have to think about the cost. And all of these things are important because these are things that the people engaged in this work in this program are going to be spending time and effort and potentially money on. And we want to be conscientious of that and thoughtful about that as we develop this accreditation process. Next slide. And finally, we've asked ourselves the question of when. Right now, this is a theoretical idea, but we want it to become a concrete idea. And so we've started to think about timelines and making this concrete with milestones. We've asked and talked with the executive committee about when we would start offering accreditation, and we'll show a tentative timeline later. We have to think about how long the process might take. And we'll have to answer the question, how long does accreditation last? How often would a program need to renew, and what's involved in that? Next slide, please. So as you can imagine, with all of these questions, there have been many committee discussions. There's a wide variety of perspectives on all of these topics, and we're continuing to seek input because I think it's important that we factor in as many different considerations as we can. At the same time, we want to move forward in considering some concrete ideas so that people can give us specific feedback. And so through the first few months of this year, our committee worked together to brainstorm 82 potential accreditation criteria. We've submitted those to the executive committee and the leadership council. And today we'll share a link for any interested members to also participate in review of those criteria. We're seeking consensus on what would constitute a core accreditation criteria for an academic global surgery program. And during the session today, we hope to gain more information and get some more feedback from all of you. First, we're going to share 3 of our proposed accreditation criteria to show you what the question is like on that larger form that we've shared with all 82 and give you a flavor of the kinds of things we're thinking about. And then after that, we're going to go into breakout sessions where we will ask you to consider some of these questions that our committee's been thinking about. And we'll have a chance today to report out that information. And we'll also provide a link where you can reach out to contact our committee if you'd like to share your input or thoughts or participate more intensively in the process with us. So I think next we're going to move to briefly to another Minty poll so that we can look at a few of these proposed accreditation criteria in different areas. So we'll pull these up. Okay, so our first proposed criteria is on the administrative side of things. And it is the program must have a written agreement with any collaborating facility, sites, or institutions that is reviewed and updated as needed on a regular basis. And the question we're asking people to answer right now is, do you think this should be a core criteria or this should not be a core criteria? We'll give a short time for people to read and consider and submit your answers. All right. We have 10 responses so far, but that may be all we're going to have right now in terms of participation. To keep things moving, because I think mostly we certainly do appreciate the feedback. We're happy to have people engaged. We primarily want to give people a perspective of the kinds of things we're looking at. So maybe soon we'll cut off this poll and move to the next one. I can't hear the room for some reason.
We aren't saying much. Can you hear me now?
Yes, I can hear you now.
Yep.
I think whenever you're ready, we could probably move to the next proposed criteria.
I think that people are saying that they may not be able to hear you, so I'm not quite sure why, because we can hear you and we are known as Jade. Jade, are you able to hear?
I sure am. That's an AI note taker that's kind of chiming in the chat.
There is a request in the chat to share the link for the polls, if possible, for those who can't scan the QR code. It also at the top, if you go to minty.com, then there's a numeric code at the top of each slide here you could put in to vote on the specific question. The second proposed criteria we wanted to share today as an example is in the area of training, and says the program should document guidelines for appropriate supervision of traveling trainees, which should include a level of supervision consistent with standards at their home program or local standards, whichever is more rigorous.
Yeah. Submit. Sure.
Okay, maybe another 30 seconds or so on this question. I'm happy to see that we seem to have a consensus on at least the ones we're presenting today. That's fantastic. All right, why don't we move to the third example today for the group poll. All right, the third proposed criteria that we wanted to share as an example is in the area of research, and says the program should have research practices and authorship policies to ensure equitable engagement and publication credit for publications arising from these programs. All right. And again, I appreciate everyone's input. And while I'm happy to see that there's largely consensus on these three items among the people who are voting today, we're also truly interested in the dissenting opinions. Whoever is voting that these should not be core criteria, we would love to hear those perspectives and commentary as well, because it'll help us to guide what the final list of criteria is and how we apply those in the process. Now that everyone's had a little chance to see the kinds of things that we're proposing as criteria, hear a little bit about our process of getting to where we are so far, we're going to shortly move into breakout rooms, both in person and online on Zoom, where different groups will have a chance to discuss a variety of questions about the accreditation process, and then report back to the larger assembly here. So I'm going to mute my audio for a minute so that there can be an explanation of the logistics of the breakout room.
While we're getting it set up, I'm gonna go ahead and just briefly give an explanation of how we're gonna do the breakout rooms. Right now, we have 3 rooms online, I think, each of whom will have a moderator. We're gonna have probably 2 tables in here based off of the current attendance, and those moderators have been assigned, and they know their documents that they're gonna be going over with you. So if you guys in the room could just split into 2 tables. Dr. Davis and Dr. Price are our moderators, and they have their documents. Likewise, online, our 3 moderators have their documents. And then when we come back into the room, we're gonna give each of the rooms 2 minutes to discuss their kind of consensus results from their discussion. And there's 20 minutes total in the moderating room. Are we ready for the Zoom break? Okay, so the Zoom breakouts are gonna go now, and if you guys don't mind just splitting up and discussing, we will let you know when 20 minutes have passed. Okay, I think everyone is back out of the breakout rooms online. And so we will start with room number 1. We're gonna go, I think, in order of the room numbers. So Dr. Riddle was the moderator for that room. If you guys want to start your 2-minute report out.
Yeah, Dr. Kewal Ramani is going to report out for our room.
Hi everyone. So we discussed the benefits and the potential costs of accreditation. For the benefits, we identified that having standard guidelines helps input from diverse viewpoints. At that, the faculty and students might have more learning opportunities than having a siloed approach. And on the alternate end, we identified that it might be expensive and time consuming, that all guidelines might not apply to each institution uniformly when you compare it to high income and low income countries, and that aligning efforts might be challenging to achieve accreditation. Dr. Riddle, do you want to add something?
I think that was a great summary, and I appreciate everyone who participated in the discussion in our room.
Okay, that was only 1 minute, so good job, guys. We'll go to room 2. I believe is Dr. Nunez.
That's right. So we discussed the accreditation process as far as what programs would be willing to commit as far as resources go. Everyone said that their program could commit time, and that ranged from the time of personnel like fellows or the lone attending themselves to administrative faculty, sort of dependent on the maturity of the program and the resources. More mature programs said that money could be contributed as well, especially on behalf of the partnership, the sort of bidirectional partnership. And then who should be included in the review of applications? That probably needs to start with a volunteer committee, but we need to be sure that it includes both HIC and LMIC representatives. As far as in-person visits, they seem impractical due to time and money limitations. And so we would probably be best relying on documentation review and applications. For accreditation frequency, we sort of settled on a range of 3 to 5 years. And it sort of could depend on the maturity of the collaboration. You know, if something's been going for 20 years, maybe that sort of reached its pace and could be reviewed again in 5 years. But if it's a new or fledgling collaboration, that could be reviewed again in 3 years. Our biggest point of contention was individual versus collaborative accreditation. And maybe that could also range from, or we could start with accreditation individually for programs, and then as we recertify, that could be based on collaborations. The danger of starting with the partnerships or the collaborations that we may miss some of the warts or the limitations of a single institution.
Awesome. Thank you so much, Jay. All right, for room 3, Dr. Baines is the moderator for that group, so we'll let you guys report out now.
Hi, hello everyone. So for this room, we had a consensus and everybody was saying yes, that research should be a mandatory activity that everyone should learn from each other. And few other salient features which we got, what are the core principles for responsible and ethical? I think the consensus was that plenty of resources are already available. We should not be reinventing the wheel, but we should be promoting equity in research. That means there should be some data protection, data sharing policies, that each interest, LIC, LMIC, and HSC, everyone is protected. Then there should be a authorship criteria that should be again equitable, that whosoever partners and depending on their contribution, they should get their authorship accordingly. And it says what policies, I think early, and we would be working on some document to create those policies. And then we will share with the larger groups. So the consensus is yes, and we look for equity in research. Of course, the context should be both local and global. Thank you. That's from room 3.
Thank you so much. We're going to go to room 5 now because that was the next one physically in the room. Dr. Davis.
For our group, we're going to have Dr. Tomby presenting summary.
Great, thank you. So we are the equity and bidirectionality group, and question number 1 is how can we ensure that accreditation process offers equitable opportunity to attain accreditation as many programs as possible. So with this, we felt there's going to be significant resource differences between the programs in the north and the south. So it's important to keep the cost and the administrative burden low enough so we can participate as many people as possible. And next one we felt is to improve equity and bidirectional is having some kind of legislation at local levels, whether at state level or federal level in the respective countries. So hopefully the equitability will come through that. And it also, when we're developing any programs, it's important to have input from high impact programs as well as not so high impact participation of programs from diverse group of nations and countries. That was the consensus for question 1. Question 2 is what are the minimum requirements for bidirectional with the partner institutions in academic post-surgery collaboration? We felt for this group, for this question, it's important to have both the in-person and hybrid or virtual learning opportunities, like having each program should commit to a certain number of videos, or at least a commitment to having certain number of fellows or surgeons exchange between programs, either 1 or 2 per year, whatever number may be. And the timeline, maybe at least they should provide coverage for a certain period of time, 1 month or 3 months in a year, or whatever it may be. So they're providing commitment is from a timeline standpoint and manpower standpoint. And also provide opportunities for research and publication ownership, having journal global study would probably help with that. And It's for, I think that's why just and when we say I on two, those are the main points. The third one was the tough one we discussed, which is would you favor having a tier accreditation program, much like our trauma programs by the ACS, or just one non-tier program, much like ACGME, you know, that's and I think we almost had a split on this discussion. And a process of having a tiered system is it will allow multiple programs to get involved and escalate to a higher level. Or the same, the con for that program is sometimes a program with limited resources from developing countries may not be able to maybe come across as feel like there is a differentiation between the global North program and the South program, so that be careful with that. That's the pros and cons of the tiered program. We felt by having you know, just one standard program, much like ACG, accreditation as a one program, probably we felt you know, that's if you're going to set up that way, the entry should be low enough for people to get those are the ones. Thank you.
Thank you very much. And finally, we'll do room number 6, clinical care, and that is Dr. Price and team.
Yeah, I would scroll down to the 2 questions. I just found the 3rd question. But our first is on what are the responsibilities of academic global surgery programs that engage in clinical care of patients? I'm not sure it came up with core responsibilities, but we did feel that where clinical care of patients is involved from an academic institution, should involve some sort of also education, research or advocacy that combines in the clinical care, which may be evaluating the outcomes or whatever that may be, that is important to have that academic kind of component. Also felt, you know, as mentioned in many of these others, the bidirectional exchange opportunities are available, but I think coming up with a specific policies is a little difficult, but responsibility to try to engage and recognize the need for bidirectional exchange and trying to fit that into what the current regulations laws allow from the different countries. Felt that it's a responsibility from both sides, that there's different environments with different areas, whether it's from a high income to a low income country or within countries, going to within countries of lower areas. So there's a responsibility on both sides of the different groups that are working together. Our question number 2 is what policy should programs have in place to promote optimal site-specific clinical care and local capacity building? We actually struggled with this question quite a bit. In terms of developing specific policies is kind of a challenge. We thought there may be something that should be developed in terms of professionalism, or having a cultural competency training before people go on and work in various areas. But that can be also really site specific as to the different kinds of cultural things that they may need to know. Policies themselves may be site specific as different laws are regulated and changed from different countries. And they'll be based really on maybe talking about human resources or infrastructure or what you're trying to develop with those policies. Our 3rd question, what are best practices for licensing, credentialing, and or supervision for traveling faculty and trainees who travel to participate in clinical care in an academic local surgery program? We just scrolled down and found that one, I'm sorry.
That's okay. There'll be plenty more time for discussion as we move forward with all of this. Thank you guys so much for very efficient report outs. And with that, I'll turn it back over.
Eli, do you want to take us to the next steps?
Yeah, if we can move to the next slide. So thank you again to everyone for your participation today. And I hope we will have the same engaged and enthusiastic participation in the coming months and years, because it is the expectation of our committee that we're going to be reaching out to other AAGS committees, members, to further vet and clarify these criteria and try to reach something that has as much consensus as possible within the organization. We have a proposed timeline. If I'm not seeing the slides on Zoom right now. I don't know if they're up in the room.
I apologize, the main computer that we're using, I've got a Zoom.
That's okay. I'm just gonna start describing it, and at some point it'll pop up, and I think we're sharing the slides later. But we're continuing our open poll on the list of proposed criteria we have now. There will be a QR code later. You can email me directly if you'd like to be involved in the review of those codes. We're going to try to wrap that up in the next month or so. Through the end of this year, our committee will be reviewing those responses and revising and updating criteria as needed. In the early part of next year, we hope to distribute these criteria to different groups within AAGS, which includes some topical specific criteria to committees that have a focus on that area, to the executive committee and the leadership council as well. When we hear back from that, we'll review feedback. We'll reach a final list of core accreditation criteria. And before we take that live, even in a pilot, I expect to share that with a larger organization and open it up to everyone for review and comment. At the same time, once we have a more finalized concrete list of criteria, that's going to inform the accreditation process as we start to build an application, a process, a committee for review. As we get into the middle of next year, we hope to have both the criteria and the process nailed down, at least for the pilot format, and around the middle of the next year to work with the executive committee to seek out a small number of programs for piloting of this process, so that by the end of next year, 2025, we could potentially grant the first pilot accreditations. And after the pilot process, we'll take any feedback, make revisions from that as needed, and the goal would be by 2026 to be able to offer an accreditation process to all qualified and interested programs. Next slide. So again, thank you so much. This really, while this is the work of our committee, and I'm grateful for the chance to participate, I think that everyone who's engaged in this organization has thoughts and inputs and perspectives to offer. And we really are seeking those and hope to incorporate the feedback we've received today and any additional feedback and input we receive from others going forward. We're excited to work towards an equitable and impactful accreditation in academic global surgery, and would be happy to hear from you in our program and to include you in the process. So please reach out with questions or comments, and we look forward to sharing more with you in the coming months.
Great, thank you so much, Eli. If everybody in here and online wants to scan that QR code that gets to the bigger survey, it's pretty extensive and it will help inform this process, but we'd love you to take some time subsequently to go ahead and fill that out to have a voice in this process as we go forward. Okay, we're gonna switch. Yeah, we have a question in the room.
Guidelines that you set up for certified registration and also case development.
So the question that came up was, is there is there any syncing with, at least for North America, with the American Board of Surgery, who kind of accredits rotations internationally? No, we haven't done that yet. That is something that, potentially we would want to keep working with. I think that's probably part two. Plus, we want to make sure that we are also honoring the other side of the programs, right? It's not just the North American one, so we wanted the standards and all this to be applicable across everyone, and then start vetting it with the appropriate entities. Okay, so we're gonna take switch things up a little bit. Dr. Gajan, who's our VP of Finance, is gonna come up and introduce our next section here.
Thank you very much. So the next few slides, Dr. Laura Withers, who is the co-chair of our membership committee, will go through and talk a little bit about memberships and the things that have changed over the last year, and then talk a little bit about a membership drive that's coming up.
All right, hi everyone. I hope you can hear me okay. I'm really happy to be here today talking about membership. Again, my name is Laura Withers. I'm a trauma surgeon based out of Portland, Maine at Maine Medical Center, and one of the co-chairs of the membership committee. The mission of the Association for Academic Global Surgery is to engage and unify academic global surgery. And of course, the best way to do this is with a robust membership. And so what I'm speaking about today is really about how important participation is, ways to get involved and participate, and the benefits of membership, which hopefully we've been building over the last few years, and we're going to continue to do so. I'll take that next slide, please. So really at the core of AAGS is a commitment to bringing the academic principles to global surgery. And this is, of course, in the pursuit of reducing healthcare inequities worldwide. And our goals are to support our members to advance these principles through mentorship, through collaborative research, and through educational opportunities. In addition to our scholarships, access to workshops and training, AAGS offers networking and leadership and resources for program development. And standardization, sorry about that, my phone just went off. So we're offering resources for program development and standardization as important to add value for the members. So by giving people a foundation and some common language, and really a standardization that they can take to other programs, to each other, and build truly meaningful collaborative interactions. I'll take the next slide. Furthermore, our organizational relationships and offerings for trainees offer the opportunities to connect and to unify our community and contribute to the future of our field. We've partnered with organizations such as the G4 Alliance through the World Health Organization, Incision, the medical student group, and of course the Journal of Global Surgery that you heard about earlier, to really break down silos. And all of this work being to foster the next generation of global leaders in surgery and to connect with others in the academic surgical space. So the way that you can optimize your participation and the value to you is to find your niche here at AAGS. And one of the best ways to do that is through joining the committees. Committees need your help, we need your work. And it's really easy to join the committee. It's a self-nomination process. Nominations are open now. You can use this QR code. And the deadline is November 15th. You'll be asked a couple of things about why you want to join, and it's a very easy process. I'd encourage everyone to look through the list of committees. We have committees that work on so many things. There are bound to be things that you are interested in, that you're passionate about, and you can join in with others who share that commitment to be a part of the committee. And then once you've joined a committee, you're already on a pathway to leadership. And I think this is another major value of our organization, because you not only participate in important academic initiatives, but you really get to shape how the academic global surgery addresses inequities across diverse regions across the whole world. And through the pathways to leadership in the organization, as displayed here, once you've joined AAGS, you can join committees. You can also join as a representative for your institution, and then move on to become either a vice chair of the committee and eventually join the executive committee, or through the institutional representative council to become the vice chair and then join the executive committee. And most of this is done through a process of either self-nomination or peer nomination. But we focus a lot on self-nomination in order to help the in order to help you get what you want out of this organization and to be responsive to what members want as individuals. I'll take that next slide. The AAGS Assembly, which I thank everyone for being interested in, is really about democratizing dialogue and bridging the gaps. All of our meetings have a virtual option. People like me who aren't able to attend in person today are super welcome, and we make it as easy as possible to break down some of the barriers to in-person attendance and still to build community. And the goal is really to have things in a variety of locations, and always to have a virtual option so that we are making both in-person and virtual attendance really accessible to everyone. This then fosters the next generation of surgical leaders and helps everyone to be able to be engaged. We also have research presentation opportunities at the assembly, and this helps a lot with the work to overcome the barriers to equitable access, especially within research and then within the conferences as a whole. And in keeping with our goal of inclusivity, we've tried to modify the financial commitment as well as to help with geopolitical issues such as visas and accessibility issues, because we truly believe that finances and geopolitical issues and accessibility should not be a barrier to the kind of knowledge sharing and building relationships that happens here at AAGS. So things that are coming up for our members in support of our mission, we are developing a new members area on the website. We really want this to be a platform that helps with greater collaboration and better resource sharing. So we are working on some changes on the website that hopefully will include some more information about the details of committee activities and opportunity for committees to share what they're doing, as well as for people to learn about activities that they might be interested in, a place to interact with other members to really collaborate for shared goals, and access to tools to enhance your programs, to participate in discussions that advance the academic approach to global surgery, and to manage your membership. So changes to the website coming that I think are going to add value for all of us. Including things like when people ask you about AAGS, some advice about what to say, a little elevator pitch that you might use to get your friends and other people who you know who work in this space interested. Of course, we have to talk a little bit about membership dues. And we are currently working on updating our dues structure. In addition to updating our membership lists and trying to update the membership sign-up survey, which is really a way to gather some of the important information about who our members are and what they want and how we can help and support our members. We are also updating our dues structure. So due to the growth of the organization, we've planned a website revamp to make that more useful for members as well as for paying dues. And we've approved a moderate dues increase to support these kinds of activities. The dues really are how we as an organization are able to fund and support a lot of our activities and help to break down some of the financial barriers to access, which is one of the fundamental missions of AAGS. So by providing a little bit of greater financial input through dues, we plan to be able to realize some of the long-term organizational and financial goals. This is really providing a small seed grant funding that will support global surgery partnerships and research and the other academic activities that AAGS is so committed to. And we have a membership drive that essentially starts tomorrow or today. This is sort of the kickoff moment for that. AAGS seeks to unify academic global surgery professionals to address surgical inequities. And as we grow, we are committed to expanding the membership to really reflect the global nature of this work. This includes strengthening representation from low and middle income countries and engaging a diverse array of professionals where we want people from clinical backgrounds, academic and interdisciplinary backgrounds, including people like nurses, assistants, and pharmacists and techs, the teams that make surgical work possible, to be able to be a part of this work. And through collaboration, our plan is to cultivate the next generation of leaders and really to continue to build this community that spans borders and that fosters innovation and the pursuit of equitable surgical care. So launching this membership drive and keeping it running through the end of the year, we are excited about the opportunity to bring even more people into the organization. And it's this that we are asking for your help. If you haven't joined, we hope you're excited about joining us. If you're already a member, we are so thankful to have you as a part of the organization. And we are offering a special incentive during the membership drive, especially for those from high income countries. If you sign up for 2 years of membership and select to auto renew, then you receive 2 years at a discounted rate of $300 rather than the regular rate of $400. So saving $100 compared to paying year by year. And this is a way for us to thank you for the meaningful long-term commitment to the vision that we share, which is a world where safe, effective, and affordable surgical care is accessible to everyone, everywhere. And while the membership committee, of course, cares about numbers, this is really about more than just numbers. It's about really expanding the AAGS community. And so we ask you to join us if you haven't already, to commit both through engaging with us in joining in our activities, committees, and other activities. And if you're in a committee, consider moving up to leadership positions and what it is that interests you. We also really hope that you'll talk to the other people that you know in the global surgery space and encourage them to join us to continue the work that we're doing together. Your involvement really is critical as we work to build the next generation of academic global surgical leaders. And we really look forward to everyone's support and continuing work shaping the future of AAGS.
Thank you so much, Laura, for joining us. Good afternoon again. My name is Mamta Swaroop. I'm the president-elect. I'm just going to go through some closing remarks. So as you saw today, much of the work of AAGS is done through the committees and depends on the involvement and participation of everyone in the group. Institutions are key players in this arena, and in fact, we have an institutional representative council specifically at the core of our organization. We invite you and your institution to join and have a strong presence and voice as we build the future of academic global surgery together. AAGS is a registered not-for-profit organization, and leaders volunteer their time, and we strive to keep costs low and our outputs accessible to everyone. Funding obviously allows us to support more scholarships and provide more resources and opportunities. So I'm just gonna give you guys like a
couple minutes, you know, in case you are already members, in case you want to donate, just in case. And so these are a couple of the important links for today. The accreditation process to get the complete survey, how to join AAGS, and then how to join a community in AAGS. Following our session, there's a students and training session in global surgery. This will be hosted by Incision, GSSA, the Global Surgery Student Alliance, and RAS Global Surgery Working Group Committee. Please stay and join the discussion and support the future generation of global surgery. Later at 6 p.m. today, there'll be a global surgery networking mixer hosted by our colleagues at the Baylor Center for Global Surgery, Stanford Department of Surgery, and UCSF, Center for Health Equity and Surgery and Anesthesia. And last but not least, we want to invite all of you to join us at the annual business meeting on December 16th, where we will be sharing our annual report, updates to our constitution and election ballots, as well as exciting new opportunities. So please mark your calendars. In addition, we are also currently working on an international location for our spring assembly, so keep your eyes peeled. Please make sure and connect with us and stay engaged on social media. Look forward to seeing you guys. Thanks.
Thanks, everybody. That's the end of the session. Again, please join. If you can, please donate. Please join a committee. All of that. We look forward to working with you going forward. If any of you are members already, if you're not, I hope you're scanning that code. But if you are members, please come up here. Thank you.
Final thing, just to announce that, again, that membership drive, that discounted rate does apply to HIC members, MIC members, LIC members. And so the idea is you get a 50% discount on that second year, should you sort of pay 2 years in advance.
Thanks, everybody.
Thank you, guys.